get started so we can talk about some things. So here's where my head's at the moment. I'm going to mostly concentrate on some quality up things that you need to catch up and talk about some pieces that are really important. And then I'll talk a little bit about COVID. I'm so sick of COVID. I really don't want to talk about COVID anymore. And then what we need to do. So if any of you got the email from Dee Rita and one of her sidekicks about submitting your quality plan, and you're not done, ready, even started, you may need to call me. I have built a base quality plan for the elements and then a matrix that you can look at and utilize and figure out if what works for you, and then it can adjust it to get you through at least part one of what we know. And so it's my quick answer from taking some work that I did last year when I wanted to get back into quality, and then what I did do yesterday. So I put stuff back on the shelf that I was working on legislatively to work on this quality stuff, because there's so much that we've got to tackle. All right. So Lena, you want to go ahead and talk about your phone buddy?
Yeah, thanks, Pat. Real quick, this telephone buddy program, it pairs older adults with volunteers for weekly phone calls. And the goal is to address social isolation, loneliness, and depression. And we currently have a lot of volunteers available to serve older adults in Denver and all around Colorado. So if you identify anyone that you work with and believe they could benefit from this, you can have them self-refer by calling our main line, or you can contact me directly and I can reach out to them. I'll send out a flyer for this program along with Pat's slides, so feel free to use that in any way you'd like. And if you have any questions, please reach out to me.
So this phone buddy program actually evolved before Lena even joined us. 2 years ago, when COVID first hit, we figured out how many seniors needed a lot of verbal support and attention. And Eileen and I were doing it by ourselves. And so we were, coordinating, getting food bought, getting utilities dealt with, whatever was coming in people's lives, medical appointments, tablets, doctors, telehealth appointments, and just every day was a different day. And it came to us that the isolation and the loneliness, not only in the ALR industry, but all over the place, was very high. So Eileen birthed this baby, and then we got some private money invested into it, and then some community money. And then we found Lena and said, here, Lena, make this thing work. Take the jam that we made and make it jelly, please. And she's been doing a great job. So even people in your facilities could be benefit from having somebody else to talk to besides you guys. All right, just a quick reminder, if you have not taken that 16 hours regulatory upgrade since all the rules changed, I highly recommend that you do that the last week of April and get caught up. If you're fuzzy about them, it's Monday and Friday of that last week. Eileen teaches all of that, and it'll help you just kind of wrap your arms around where we're getting ready to head, because I can tell you from what we're seeing nationally and locally, they're going to try to catch up 2 years of work this year. And so it's going to be a very fast-paced, very pressured season as far as we can tell. Okay. All right, I want to concentrate on some areas, and mostly what I want to talk today is let's catch up with HR and human resources, make sure you got your files in good order and that you got all the pieces. And then I'll talk a little bit about some COVID noise, and then I'm also going to talk about some new issues in rehab and home health that are beginning to surface. All right, so modernization is the catchword. Everybody is really in love with the word modernization. So HR is in this same lane, modernizing HR policies, modernizing state regulations, modernizing paperwork, how you keep it, who gets to see it, all of those things. And so one of the things that is being pushed in all industries is to make sure you have an employee handbook. And I can tell you that an employee handbook will be your saving grace. because the surveyors were going in and saying, did you get any training on this? Do you know about that? Do you know about this? And if you have really a good employee summary handbook, and your people freeze, like happens all the time, and you hand that employee handbook and say, this is our beginning orientation to our community, and these are the things that we have reviewed with them, then you can get some of that off your back. So there is one form that's super important that all of you do, whether you do Medicaid or not. It's called an attestation form. This is the jump to it. And the rate increases for HCBS Medicaid, not Innovate, but HCBS Medicaid are good right now through the end of July. One of those projects that's on my plate is I'm trying to get them permanent, because there's no way that cost is going to go down. Actually, I think cost is going to go up. So we're working, and this is a national feed into the state. And Eileen and I have been talking quite a bit for a long time. I went and did rate comparisons in states all around us, and we get the lowest rate from CMS of all the states around us. So we only get 75% of that rate, and the other states give 100%. And then they do their operations out of state taxes. So it's one of those things that is on the list for us. But please make sure that you have this and that you've done it and you have it in your HR files. Okay. All right, paid sick leave. We had legislation go through because, again, direct caregivers were getting sick with COVID, and the feds were weighing in it. OSHA was weighing it. Everybody had an opinion. And then Colorado said, okay, this is what we are going to do. So it's not that hard, but you do have to do some adaptation. So your staff gets to earn 1 hour for every 30 hours that they work, up to 48 hours of paid sick time. You cannot deny that. That is a statute, okay? In that 48 hours, if they're sick with anything like the flu or any other infection, diarrhea, bad cold, anything of that nature, then they can earn up to the 48 hours or whatever they've accrued. You need some sort of system to figure out accruing and what people have on their PTOs. There are some software programs out there that'll help you do it. QuickBooks has a program that I like, but you do need to do that. And you also need to make sure this is in your handbook, your employee handbook. And what I would recommend is that you download the statute. You give it to every current staff you have, and a second copy. They sign the copy. It goes in their HR record that they've been given this information. So there is nobody that is excluded that works in the industry that provides care in your home. Oops. All right. The next thing that we got to deal with, and again, I hope to have better information. So I have gone to the state. The federal government has saying that the old way that we've done TB testing my whole career is no longer working, and that we have too many new tuberculosis diseases or presentations in the world and in the country. And so we need to do this new test called a QFT. Now, one of the good things on this is once you get this dang thing done, is that it's good. You never have to do an employee unless they travel out of the country. Then 30 days after they return from a trip to another country, they need a new QFT test. And so this happens in our industry. We have a lot of people from other countries and they go home, and frequently, especially now with all of the rules of traveling, they're gone 30 days. And so please make sure that you understand this. What I'm working on, I'm gonna let you guys deal with your employees. I'm working on getting all 26,000 seniors and adults that we have in our industry tested. I'd like to get a base of really what we got in front of us. I'm hoping we're 100% negative. I'm not trusting that to be true. And one of the reasons that this is interesting to me is because back in the 70s, I worked in an outbreak of TB in Colorado, and we were chasing people with court orders to take medications that were refusing. So I was chasing people with a group for public health and making sure they were coming and getting their meds and then doing their follow-ups. TB was very different in the 70s than it is now. So one of the things I've asked Peter over at the department is to help me figure out if there's any way, since we got MACO contract already to do our PCR testing, if they could help us get caught up on these TB tests. So I will continue to advocate for this, because a regular doctor can't do a QFT test. You have to have special training, and it's usually done with special lab work, and Mako happens to have that certification, and then special people that know exactly how to perform this test. So I couldn't even do it because I don't have that training. So at any rate, that is one of the things that's on my checklist that I really want to see if our residents, do we have any residents that are actually sick with this stuff and we don't even know it? All right. So if you haven't got this yet, you should have got an announcement from the health department that you will be getting, when you put anything into EMR or anything into COFI, you will get an email, and anybody that's on your website that is an author will get notification that you have actually submitted. So remember, on COFI, you have to do the numbers of how many people are vaccinated, flu and COVID and all that stuff, sometime between the 1st and the 15th, and then the 16th to the end of the month. You only have to do it once. And so get it in. And then if I happen to be an author on your account, I will get notice as well. And so it's just, it's just a backstop, but you don't want to miss these reportings. And right now we're not getting full cooperation across the state. And so there's going to be some major fines coming up. And I've seen some emails go out to facilities saying you missed your COFI reporting. And even if it's the same as last time, you need to get this done. So EM resource is for your residents, and COFI is for your staff. And what they're looking at is we still have about 14% of our industry has 0 vaccines done, staff and residents. And that has really got the attention of the feds. They're looking at us very carefully on that, along other states. So, so make sure that if you are not getting this email after you've done it, that you get a hold of them and say, hey, I didn't get the email. They have sent out multiple information emails about this, and at least once a week for the last 6 weeks. Okay. All right, so here's some things that I've put on the list that I want to make sure that you are up to date. You should have all 3 of your fire drills done for this year, once a month, and then you got to get 2 nighttime ones in, so don't forget. You need to go look at your current policies on fire drills equipment and make sure that they're matching because last July, that was all updated, just like chapter 2 and 7 was in our life under fire and safety. If you go into the state fire and safety, you'll see it's a chapter 8, and make sure that you download that and put it into your desktop. And then so fire and life safety is super important. And then get somebody on, so one of your night staff or evening staff, to clean all of your extinguishers and stuff, because in the houses I've been in, they're all greasy and gummy, and the cards aren't caught up. So if we think about how you don't have to do the work, you can assign it, but you need something that's given to you on a monthly basis so you can put it in your book that you're caught up and that you're current. And then if you haven't had a fire inspection for your house, please get that scheduled and get those caught up, because you will not get relicensed if you don't have a current fire inspection. Your resident engagement is the next big thing that we need to put back together. Residents now that are fully vaccinated can be out in the community. And here's the big hassle. We want them to wear a mask when they're out in the community and not bring anything home. And the community's not wearing masks. So it's very confusing to them. And some seniors are really good and they just do it because they feel safer. Others not so much. And so I try to pick community activities that are better, have better ventilation and better policies in there, but pretty much everything is waking up. So the libraries, the rec centers, like over at Lakewood Cultural Center, there's a bunch of stuff, really cool things coming up in the next few months, events, that type of thing. So whatever things you choose for community engagement is part of one of your obligations, is that your residents need to have knowledge, access, and attend things that are outside your home. And so it might be a baseball game, it might be a high school football game, it might be, a library event, whatever it is. But they're looking at activity calendars, and you can't put bingo, and puzzles and self activities down. That is not going to fly. So your activity, so they're asking you as part of your outreach to the community, to bring the community to blend with you, is to start thinking about how you're going to do that. Now, a positive thing on this whole good thing is age-friendly communities and dementia-friendly communities are back up and functioning. So for those of you that do have dementia care communities, there are activities for them, and there is restaurants that are going back and opening up a lunch for your group at 1 o'clock and lower cost, that type of thing. And I know some of you will say, well, they never have any money to do activities because they smoke it all. Well, that's true, but that's not going to get you off the hook. So this is federal all the way down to state. And so activities is really a big thing. And you need to have an activity assessment done for every one of your residents. You should do a new one for this year because all of us have changed their mind about what we want to do anymore. And kind of catch up and kind of figure out what your community is interested in. I do have some vetted activity assessment forms, and I'm glad to give you what I have. They're out of the Pioneer Network in the East Coast, and they're all written and they're easy to do. The resident can do them themselves. So there's that. In your service plan, you must have a sector that says community engagement and activities. So like I said, for some of you that run a locked dementia, it's going to look very different than like, I'll pick on Maggie, who has a community for those that have mental health disorders, and they're out and about anyway. And so a lot of them do independent things, not that they're doing things that makes Maggie happy, but they're out there. And I happen to drive by that every day. And so I see them out and about in the community. Okay. And so the big thing is this whole process of what is called safe. And we unfortunately have legislation that is trying to be crammed down our throat of what is a safe assisted living. And Eileen worked all week so far and quite a few hours this morning. Personally, I'd like the bill to go away. I don't think it's going to happen. So we're trying to get it to a moderation. And this whole bill is going to, again, change Chapter 7 and Chapter 2 on what does community safety mean and what does community engagement mean. All right, so back to human resources. So when you hire somebody, you have some obligations of things to do. And when you do an interview, and before you do this stuff, do your second interview, make sure that you want to sow in time and energy into that person that you actually want them as an employee. So you got to get your CBI test or your CBI work done. You need to go on DOOR's website and under licensures and run their name and date birth, make sure that they did not lose a license in another profession, because there is regulation about whether or not you can hire them. You need to go over to the QMAP site and make sure that they're valid. We've had a lot of people claiming they got QMAPs and they're nowhere to be found. And then I want you to go run on the state sex offender public list and run their name, both men and women. We're finding both on the sex offender list, because if they are, then we've got to figure out what that whole story is about and how they got on there. Then CLIA is my new headache and project. So back when COVID hit, we got the state paid for all our facilities to be able to get onto CLIA. This is validation that they actually have vaccines. The cool thing about CLIA, it was actually built by the school systems for flu shots and then mumps, measles, diphtheria, all that good stuff. And so all of those vaccinations are on file. Well, when I went in to find mine after I got all my COVID, I realized the state had not put me in. And so I had to go and fix that process. So vaccination cards, unfortunately, 10,000 cards were stolen about 2 months ago and been distributed all over the state. We have a lot of false vaccination cards out there. And to be very careful, guys, because CLIA, at least, is, if you have a CLIA report for residents or staff, the state can't argue with you. If you have a vaccination card and they look at it and they go, oh, this is a fake, you're going to have a really hard time proving that somebody actually doesn't have a fake card. And we have already seen that happen. Make sure you have some sort of resume or application. And the big thing on that is they want to know if people can read and write. we have been tolerant to hire people with disabilities, but we need to do an ADA accommodation if we're going to do that. And reading and writing is one of the big things that irritate the surveyors a lot, is when an employee does not have those skill sets. And then get a reference check that makes you happy. If you have drug testing as a pre-hire, you must have a policy to match that, and they have to sign a release that drug testing is a precondition of hire. You don't have to, it's not statutory, though it is recommended in healthcare federal noise that you do drug testing. If we do not test for marijuana or byproducts of marijuana in our state anymore, you're actually looking right now for fentanyl and opioids. And that's the big one, because unfortunately, a lot of employees in this industry are users. All right, so you get all that done, you're happy. You have your interview, you say, you know what, I'm pretty comfortable, I would like to hire you, but you cannot hire until you get that CAPS clearance. And CAPS is taking freaking forever. And so the reason I don't do CAPS in the first is because you have to pay again. And you might find out in your first query that you really don't want to hire that person. So why do you want to waste another 20 bucks on a CAPS? But if you're going to hire, you got to get your CAPS. Then you've got to do your I-9s, your W-4s, your job offer has to be written, and there is forms, the state has developed forms what a job offer has to look like. COVID responsibilities, you want a signed form for COVID. So in other words, and this is my big spiel all the time, is that we are 100%, all employees must be 100% vaccinated and fully vaccinated. I'll tell you the reason I went that way. It came out of talking to liability insurance companies. So when you get you're going to get your new liability insurance, they've got 3 new things that are on them. And we're down to 2 companies in Colorado right now that are trustworthy with liability insurance. And one of these criteria that they're asking for is your vaccination policies and your results, or how you're doing. So like I said, you really think this through. And I do have information and given it out to people on the state stance on waivers. And there's one form that you can use, and how you have to have that in your file, and how your policies have to look if you're going to do a waiver. So it's extremely crazy, and I don't see that getting any better. Make sure you take a picture and a headshot for your HR file, not for your community file. The reason for this is just like on Mars, you have a picture. If you have a theft or an elder abuse case or an at-risk adult case or anything else where the police gets involved and you have that headshot, you have a higher chance of actually processing that through and it not getting thrown in the trash. And then a current driver's license. On the driver's license, guys, one big quick clue, the star. That tells citizenship. If they don't have a star on their driver's license, then you got another layer of diligence. You've got to get a, if they have an HB1 or an HB2, you got to have that. Or if they have a permanent green card, you got to get that. So make sure that if you have the star and you copy the driver's license, you're covered for citizenship or eligibility to work. If they do not have a star, you got more work to do. All right. There's some standardized forms for what's on the employee file checklist. And I have a couple of samples of those. And then your training topics. So these are the big ones. I am working with a graphic artist and an author. We're playing around with actually getting these, what's a good word I want to say, getting these built and getting them taped, and then putting in some trainings from federal sites and state sites that will help so that you don't have to say this crap over and over and over again. And I see that as a real challenge in the industry. You get sick of training. And so hopefully by the end of this year, they will be available to the whole industry. And so it's been fun to start working on these and building something that we've needed for a long period of time. And then there's some things that you'll need people to take and repeat. And so one of the newer projects out there, it actually is 2 years old, it's called Mental Health First Aid. It was started in Jefferson County, kind of fell into it by accident. And the lady that built it now is the head of Boulder County mental health. And anyway, she sold the whole thing and the state bought it, and now it's national. And so mental health first aid is free, and it hooks up to in your county a particular trainer. And like I said, I'm glad to help you figure it out. Kind of got that sorted out in my head now, how to get there. And mental health first aid helps deal with heat. How do you deal when somebody's angry? How do you redirect somebody? How do you deal with your own emotions when you're feeling really stressed out or tearful, or you just can't, you don't want to do this anymore? So I love the mental health first aid project for the direct care providers and yourself, because it gives you some new tools to use. And then they need to understand HIPAA and PI. I'm still seeing facilities putting pictures of residents online. And that is a PI violation that will get you in huge trouble with civil rights. So if you're going to do social media with residents and staff involved, you've got to go through a whole social media policy and get it vetted and get it approved. And it's a hassle not worth it, in my opinion. If you want to put on your website like a picture showing that what you guys are about, make sure that you have a release for that one picture. You can get away with that, but watch your staff, because I'm seeing it coming on social media again, and that's very scary. And then the other thing that's going on, I do not know where we're going to go with this story on the long run, but they want all of our facilities, all 650 of them, to have some basic dementia training to recognize early signals of dementia versus behaviors. And we're kind of fighting with that, because we don't all of us do not take care of folks with dementia. And so I don't know if we're going to win on that, but I'm bringing it to your attention just in case it actually becomes statute and we get pushed into this. So first aid generally is only good for 2 years, CPR. QMAP, if people are making errors, make them go back and take the QMAP class. I have found 2 online QMAP classes that are decent and reasonable cost. And so they're good. And then there's a supervisor QMAP regulation in Chapter 7 that somebody in the facility is the oversight and does all the quality for all the medications. And it may be you, and it may be somebody you can assign, but you must have a process in on how you're QAing your medications. It's one of the top 5 things they're asking on the surveys as they're out and about right now. All right, so employee records. If you guys use Pinterest, I have found some incredible free forms on Pinterest and all kinds of things in HR. And I found this one, it's really simple. And this is a training tool. And it was the topic, the date done, the 3 top things that they were talked about in that training, and then the person that took it signs it. And it will work for your training, for your annual training, for your ongoing training, job specific training, whatever you're doing. So you need something. And like I said, Pinterest has got some free forms, and you don't have to reinvent the wheel there. Okay. All right, kitchens. Kind of getting a new feel. I kind of started realizing that with my grandchildren in California, not my ones here because they all cook, but the California kids didn't have a clue. And I'm not going out there as much as I am, so I'm not going to be able to help solve that problem. But I'm starting to realize that a lot of young people don't have a clue about cooking. No skills, no knowledge, no training, nada, zero. And so there are, programs out there for your kitchen, diets, menus, supply management, all of that good stuff. And then they have recipes, and at least the recipes are helping in some instances. But I just find it fascinating, because in my growing up years, you were expected to be able to cook by the time you were 10 or 12 years old for the whole family. And so it was just mind-boggling to me that that's not an expectation of raising kids anymore. Somebody in your house has got to take the kitchen management class. It's from the state health department, and Pueblo has one Fort Collins has one, Grand Junction has one that are pretty similar. But somebody in the house has got to have that second layer class, and then they are responsible for the whole kitchen management, how it's set up, infection control, how to deal with the refrigerator, how to store food, how to mark your food, all of those things. So the hot topics is kitchen zones. And so you're not cooking at your house, you're cooking like you're in a restaurant. And if you look at restaurant cooking, it is really parallel. So in kitchens, they're built in zones. Clean is clean and dirty is dirty. It's the easiest way to remember it. And cross-contamination. So like a dishwasher, you have to rinse your dishes, sanitize them if you don't have a dishwasher, and then air dry, and you can't stack them on top of each other. So that is a violation of how, and you can't wipe your plates and stuff down with a tea towel, and it has to air dry to let that sanitation cycle work. So cross-contamination is a pretty tough, especially in our small homes, or a small kitchen if you have a bigger facility, if you don't have a lot of room. You need to know what hot and cold temperatures, and you need to be open a cabinet door and have what temperatures need to be tested with your red thermometer for meat and with your blue thermometer for cold. So like you're making pudding, you can't leave it sitting on the counter, or salads or Jell-O or ice cream. It all has to come directly out of cold. And so I see violations in that fairly often. Don't forget that you have to have menus posted for 2 weeks. And then how do you serve? So do you serve family style? Then how does that work? If you serve plate by plate, they have to be covered from the where they are made to the delivery, and you just can't put 5 on your arm and away you go. So you got to rethink about how you're managing your kitchens. And then one of my pet peeves is when I go into houses and they don't have aprons. So aprons are required as a protector for the person cooking, and they don't go into the house and they don't go down the hall and help somebody in the bathroom with their apron on. The apron stays in the kitchen. An apron is good for that one shift. And if you have aprons that can be washed, you fold it in, it goes in that laundry bag, and then you wash all your aprons together. I highly recommend you use black gloves in your kitchen. The reason for black gloves is one, they repel fat, which is a carrier of bacteria. And 2 is you can tell if they're dirty. And so black gloves are much better for kitchen management than blue, and you'll have better compliance with your staff. The other thing that I'm seeing is people not having hair management when they're cooking. So the same rule as if you work in a restaurant, your hair can't be flying around. And then eye protection if you're not fully vaccinated. So if you are not fully vaccinated, that means you have to wear an eye shield your whole shift. And if you're fully vaccinated, you'd only have to wear an eye shield now because Colorado has got out of the red finally, if you're doing source control management, which means giving a bath, helping somebody with incontinence, or you're in a room where somebody has got symptoms. So again, just quick review: kitchen responsibilities, training, validation, competency is all super, another one of those big hot ticket items. All right, so let me review a couple of golden rules about QMAPs. So some people have been QMAP trained a long time ago. Please send them back to school. There are 7 rights in QMAPs. If they cannot tell you those 7 rights on the interview, you don't have to not hire them. That's fine. Send them back to school. They must be able to tell you what the 7 rights are and understand them. It should just come right out of their mouths. Okay. And so their competencies, and you're watching them and making sure that they are following policy, that they're not contaminating themselves. And it's really easy because they will wash their hands, put their gloves on, and the first thing they do is open a computer. Well, that computer's filthy. And so again, that process is super important, and that they all go into the cups, the pop them, they don't touch the pills, and then they can't pre-pour. You know, there's still some agencies around the state that think they can pre-pour. It hasn't been acceptable for 20 years. And so it's one by one by one by one. And so this cannot be an afterthought, and you cannot let them do medication independently until that you've proven that they are competent and consistent. The other thing I'm working on, and it's not easy, but communication is both written and verbal. And so in this new work that I'm doing, I'm hoping that we're going to have some enhanced trainings to help talk about all of these topics. And the ones that are important is the art of coaching. Coaching is very different than telling. And so the young people don't, at least this is my observation, young people want to be told what the goal is, where the information is, but they don't want to be told the middle. They want to do it themselves. And God, they waste a tremendous amount of time running around trying to figure out the middle. And so they don't want to read great big long policies or how-tos. And so I find it interesting in this late teens and early 20 group that I get to talk to almost on a daily basis. So we have to figure out new ways how we're going to give them the tools they need and make them feel comfortable and consistent. So coaching is an art. You won't learn it in a day. Some people are better than others. I have a mother's voice, love to use my mother's voice, and I have to work on coaching all the freaking time. It's not something that comes to me naturally, okay? Heat is one of those incredible tools that will help you turn off when people are angry or frustrated. And we all can do better at that. And we all fall apart. Just know your triggers or what upsets you. And so for me, it's driving, especially 6th Avenue. And we have, especially in the summer down here in downtown Denver, we have some motorcyclists, and they like to show off and they like to drive on one wheel. So they'll have their back wheel up in the air or their front wheel up in the air, their legs up in the air, scare the frickin' crap out of me. And I really, it triggers me because I am so sure I'm going to hit one of these fools one of these days on these motorcycles, and Denver police is not interested in them anymore, and they're not doing anything about it. So it's frustrating to me. Those are kinds of triggers, and we all have them. Your residents have them, your staff have them, things that will set you off in a hot minute. And well, you have to understand yourself, and we have to help our residents learn about theirs. We have to be careful with our communications with families. I found through COVID, the more we do written communication, the better off we are. Because a lot of times in spoken language, even in this class, it'll go in one ear and out the other, or you'll quit paying attention because, oh, I don't need to do this, and you just quit listening. And we all do that in everything we do. In your staff, though, documentation is big. I see things that are documented, and I'm like, holy cow, you got yourself in a jam. You cannot use those books, they got a lot of names, where you put the events of the day and pass it on to the next employee, and they're supposed to read what's been going on and then make decisions from that. Anything that is written has to go in the resident record and not in your little journaly thing, or however you communicate for between shifts type thing. So you have to really think about carefully, because if it is important, it should be in the resident record. And we have to teach staff how to chart in resident records or how to document. And we also have to teach them how to write an incident report. So one of the things that I run into fairly often is I see things like, I believe this, or I think that, or I know this, or I know that. If it's got I in front of it, we've got to get rid of that process. So there's no I's in any documentation. It is facts only, and then potential evaluation, and then what did you do about it step by step. So incident report writing, grievance writing, which are all required now, and documentation and resident charts. So I think it's really hard. So let's say, for instance, you have a fairly large size facility and you're coordinating medical appointments and going to get meds reordered and dealing with the pharmacy. It's really hard to document all that good stuff. And so sometimes some facilities like task sheets. And so they'll have a mitigation task sheet, and then they can just date it and then document, and then who, and a little bit of verbiage, like maybe 3 to 5 words. If you need something like that, build it, use it. It's okay. But be very, very careful on documentation, because all of this stuff goes, if you go to court, this is all what we call discoverable. And if you got, I think, I wish, I know, any of that type of stuff, you're going to lose your court case in a hot minute. So be very, very conscious that this year you change those kinds of things and get more formal in documentation and written and spoken communications. All right, phone etiquette. Most of you, when I call the facilities, have really decent phone etiquette. I hardly ever run into anything that's crazy anymore. But what I don't see good policy or process is how to take a message. And so you might want to think about how you want that to look, because just like when somebody comes in your house, I call it the fan base. So you hit the front door, and as wide as I can spread my arms, that's how I judge your facility. If it's clean, neat, together, organized, friendly, feels warm, feels like somebody actually lives there, that's one thing. And if I come in and it's a hot mess, I generally don't want to stay, and we'll go right back out the door. That's how families also see you when they come to see your facilities for their family member or, parent, child, whatever's going on. So that fan base is important. Well, the same thing on messages. I probably get, we probably get somewhere around 30 to 50 calls a day here. And the one thing I get almost consistently is, thank you for calling me back. Nobody ever calls me back. And the hardest thing for us, which drives us over the top, is we call back and the seniors won't answer their frickin' phones because they don't have us in our contact. So I changed our messaging to, please add our number to your contact list so you know who we are when you call you back. Well, believe it or not, it's starting to work. And so when I'm calling people back, they're actually picking up the phone. So I'm having a little success at that. But you want to think about, how do you want messages taken and how do you want them distributed? All right, resident rights and house rules. Okay. Again, confusion. You cannot have 30 pages of house rules. You have one page, probably less than 5. House rules are for everybody. That means that everybody abides on the house rules. And resident rights restrictions, for instance, you have a resident that smokes and you need them to smoke only in the smoking area, and they must extinguish their cigarette. And then you have to put a fire retardant trash can in their room because they have a big habit of putting their butts, or whatever they call them these days, in their pocket, and they think they're going to smoke them later, and they throw them in the trash can and catch a fire. We've had fires this last season, this last 6-7 months. And so it's another thing the department's looking. If you got smokers, they go check every one of those rooms for a fire retardant trash can. They are over at Home Depot. They're also at Lowe's, and I found them on Amazon. They're not expensive. They're pretty reasonable, but make sure you have fire retardant trash cans if you have any smokers in the house. So house rules have got to be for everybody, and be very careful that you're not violating HCBS rights that's on the HCBS page under FAQ 1 and 2. And because they do have rights. So I've been headbanging for a long time on this one. The 24-hour visitor is a right under Medicaid HCBS. I don't agree to it and I don't promote it. But we can't put a sign up saying visitors 8 to 8. We can't do that. You can have a sexual partner in your room anytime you wish, also drives me crazy. And my gut level is, if you are able to have that part of your life and you want that as part of your life, you should live in the community. And so, again, I struggle, but those are rights that are over there. So remember, there's civil rights, there's voting rights, there's rights to your own time frame. So you cannot say, if you don't eat at 7 o'clock, you miss breakfast, too bad, too sad. Can't do that. You got to have a 2-hour period for every meal. You got to have snacks. So if you need me to look at your house rules with you, I'm glad to. But generally, there's about 5 that you can use. And you really want, the less house rules you have, the better. My typical one when I help facilities write their house rules, number 1 is the golden rule. We treat each other with kindness and respect. And that's my number 1 rule that I use all the time, because we've got to put kindness and respect back into life, because we're out of compliance. as a world, as a country, as a state. So again, you have to train to house rules and house and resident rights with your staff in orientation. And so you will have to make sure that you have that in your training modules, and they sign off that they know where the house rights are, they or the rights and responsibilities are, and they know where the house rules are, and that they're current. Because again, the surveyor will ask whoever answers the door. They have about 10 things they go through, and they'll say, show me where your administrator information is and the phone number that has to be posted in your common area there. Tell me where the ombudsman poster is. Show me your house rules. Show me your rights. Now explain these rights to me and how you honor them. And whoever answers that door gets picked on. So you got to practice with your staff. They need to understand this, because again, they freeze and they just, things come out of their mouth that always amazes me. All right, another HR training that you got to do annually and within the first 30 days of employment is elder abuse training at the old term, and then term today now is at-risk adult abuse training. We were the 48th state to actually do those rules, and we have moved to the number 5 state in the country actually prosecuting for elder abuse, financial exploitation, sexual abuse. A lot of times the tags are put on with other felony tags for sentencing. And so there is a lot of movement not to put people in jail and to do other things, but we're seeing some very interesting discussions going on that. So we have federal and state statutes. I have a training that I have done. I probably just need to do some updates. Maybe I will tape it like I've done this. I'll offer it to whoever wants to come. I'll tape it and put it on our website. It's something that's really important to me because I've been involved in this for over 15 years. And it took forever to get Colorado to wake up and actually start dealing with it. And then it was super sad to find out how frequent it happens every day. And so the other abuse that you need to have in your policies and in your HR books is stealing will not be tolerated, period. It is, and they will not get unemployment, because if you can validate that somebody stole from a resident, and we've seen wedding rings, money, medications, personal items, pictures, all kinds of things. Had a situation where a senior son, a staff person talked to senior and is signing the title over on their car. I mean, just it's unbelievable to me what they figure out or think about. But you need to have a really dead drop policy that stealing will not be tolerated. That's the other reason for the picture. The only way we've been able to get prosecution to happen is by having that picture and then being able to figure it out. So back to cameras. Well, not back to, but the topic of cameras. So for a long time, we kind of were in a trend where we had cameras all over the house in the common areas. You cannot have cameras in the common areas. It's a violation of resident rights. But you can have a camera on your med cart, and I highly encourage you to do so. I like the Nest, because frankly, the little tool that the Nest sits in on the med cart, people forget what it's all about. And then it goes only to your telephone, and you can turn it on and off at will. And you can watch, because med thefts are up. And people are looking for drugs to steal, especially PRN drugs that they can get some money. And inhalers, insulin is really big. Insulin, blood sugar strips is really big. So like in my community, when those signs go up, we buy insulin strips, or we'll buy your insulin. You're not using your insulin anymore. I pick all those up and I drop them off over at the mayor's office, because again, it's big business. And it's one of those things that we've got to be very, very, very strong about, that we will not tolerate any kind of stealing. All right, so for those of you, I've got a few of you on the line that have dementia homes. These are some of the enhanced trainings and some of the regulations. This is going to change. It's probably going to go up in hours per year, and then some more specific topics. Ray, just for your knowledge, Tiva Snow has dropped to like 4 new YouTubes on YouTube, and I've watched 3 of them. They're really good. I love that lady. She's probably one of the best trainers I know for Alzheimer's. And there will be other trainings because dementia is a big topic. And so you have topic of the month, you have your orientation topics for dementia care, and then your annual trainings. So again, if you are a memory care, locked memory care community, you have some more obligations for training. All right, so I wanted to give you kind of a bird's eye of one of the checklists I found on Pinterest. So this would be a typical employee personnel file document tool that you would check and say that you have. One of the things that I like to do when I'm helping facilities is buy one of those stupid, super expensive HR files. And Amazon has them and Sam's has them in a single person. They're 15 bucks. I like one. And then you can just take regular manila files and replicate it and use those prongs, those 2-point prongs, and build your own HR files. And you can do it for like $1. So this is what goes in them. And this is the order they should be in. And so, like I said, this I just stole right off of Pinterest. You can use whatever one makes you happy as long as you've got all of this documentation. Okay. All right, so here's your list of competencies. These are regulatory. Okay. And this is your first 30 days, all the topics that have to be addressed. And then these are your annual and special considerations, depending on what your facility does. Okay. All right, a little love note. Again, there was, and actually Maggie sent this to me, so I just copied and pasted it from your email, Maggie. And this is your billing if you're under HCBS. And so you can have this for your policy book. And if you are if you're having trouble, talk to Gainwell, and that's about as much as I know how to get it solved. I haven't had anybody complaining to me the last month. Since I complained to the head of HICPUF that the billing was being denied. And so she put Colin on it and a couple other people, and then I didn't get any more complaints. All right, so public health orders. They have been extended through the end of April, AKA 95 masks on for all staff at all hours working in your facility. Nobody cannot use them. And it has to be the stupid N95s. I was trying to get it back to the blue mask. Those N95s are so awful. They are awful, awful. I'm glad I don't work in the hospital world anymore. So please copy this and put it in section 4 of your COVID notebook so that you are current in your policies. Okay. And then on page 54 of the RCF, again, this is something you may want to copy and put in your section 4 for your policy and not retype this whole stupid thing, or just take it off this slide, whatever makes you happy. Next Wednesday, Peter said that they're going to update how often we have to do PCR testing. We only got 2 counties left in the state that are red. Everybody else has moved down to orange and some to green. I'm hoping we're out of this whole nonsense of testing in the very near future. Even though we have a new variant of SARS in the state, it's not seeming to kick ass in the hospitals. So this is what is current. And then next Wednesday, we'll know next steps. Okay. So this was updated January 24th, and a lot of people missed this. And it's not easy. It's not easy to follow. And this is one of the reasons I brought it back to you. So what pages this stuff is on, so you can go back and look at your RCF from the newest one that was published and see if you can wrap your arms around the darn thing. But remember that masks are mandatory for all staff. Eye protection is mandatory for all staff that are not fully vaccinated, period. There's no discussion. They have to clean their masks fairly often. And then there is some new cleaning guidelines for the, I like the shields with the headband and the shield that goes down to your chin over the goggles, because we have learned in the goggles that the rubber in the eyeglass is actually holding on to some other bacteria that can cause issues. And so stay steady, don't lose on this yet, and pray that next Wednesday we can start getting out of this. All right, so here's the new rules. And again, I just wanted to have them really easy for you. And so this is called surveillance for asymptomatic people, okay? And who have not had a close contact or a high risk exposure. And so recently, there's been several white papers published that people that had early COVID back in 19, of what we're starting to see in the senior communities and in the public community, with increased rate of dementia people are getting sicker with their dementia faster. Some new stuff with energy. I was talking to a lady today and she had COVID in 19, it impacted her bones and now her bones are disintegrating and she's bedbound and she's only 53. And she's really scared of what's next because the doctors are saying there's nothing they can do for her. So it's starting to come out. We're going to know more as we go. We just don't have a full picture of this, but I wanted to give you these again for your policy book and get you at least trying to figure this thing out, because you need to order more testing supplies. You may need to talk to Mako or the lab, because the state lab is out of business for the community. You may need to figure out whether you're using CSU or Pueblo or whatever you're doing, and figure out that and then document what your protocols are. All right, so I wanted to give you this definition because again, a lot of confusion of what is a community level, okay? So when you go out shopping, you go out in the community, you go to a game, whatever, you may or may not need to wear a mask, but our facilities are not considered part of that. So I had one administrator and we talked it out. She had a family member that was dead set. She was coming in that house, coming hell or water, and she wasn't wearing a mask. She wasn't washing, she wasn't checking in, and we wouldn't let her in. And so she thought she could get the police on her side, and then she found out that wasn't going to work. Then she thought the ombudsman would support her, and that didn't work. And then she thought public health would support her, and that didn't work. We are not part of the community. We are a health facility. So this is really causing some grief across the state. And so I'm just saying, stay steady, guys, stay steady to your visitation only in the common areas, stay out of the bedrooms. You don't have time to do that cleaning protocol. Outdoor visits are better. If you can pull that off, I highly recommend it. And they must wear masks the whole time they're visiting with their loved ones. They are not going to like you for it. All right, so I've talked about that already. All right, the other thing, just a reminder, page 23 talks about what is source control, and it's a terminology you got to get comfortable with. And what's more important is what's on page 23. And so you might want to review that and what that means. What is social distancing, especially if your whole house is not fully vaccinated. So you have to be 100% fully vaccinated to get some normalcy back. All right, so simply put, right, be very aware of what you're doing, be very consistent, make sure you have enough product. Make sure that each room that has a resident in it, when you enter that room, you have clean gloves for that room. If you have to wear a gown for source management, that you have it available, and the gown comes off before you leave the room, okay? And if it's disposable, then that trash is picked up at least every 4 to 6 hours and is disposed of. Follow your community guidelines for medical waste. And if it's washed, it goes into a special laundry, and only gowns can be washed together, and aprons in the kitchen should only be washed together. Do not put it with other laundry, okay? And do not wash gloves for reuse. The only gloves that can be washed and disinfected is those yellow cleaning gloves, because those are Mylar and they're non-permeable. Okay. All right. If you need new visitor signs, they're on page 34 and 35. And then if you need the exemption form, I gave you that as well for exemptions. Like I said, be careful of what you are going to tolerate. You've got one staff person per agency that can have a religious exemption, and then that person gets to wear full garb and look really silly in your community. So not easy when we're so short-staffed. Okay. All right, so April, my intention is to keep building catch-up work and helping you build your QMP and upgrade your QMP. If you get that email from Dee, I think the sidekick, her name is Nicole, I will help you as an individual get caught up, but I'm going to help the whole industry that works with us. I will, April and May is to try to get everything as caught up as possible so that you are thinking through. Because we've got a project that we're going to have to work together, and it's going to take everybody's input. We've got to build a whole new emergency evacuation plan. Everything that we thought would work just fine, the floods, the fires, the COVID, all the other stuff has fed into it, and it has totally disrupted what's going to work. I've been looking at different county emergency preparedness plans that's posted on their websites because they're in the same process. And fire marshals, they're not going to come to your facility and take your residents and get them to safety zone. So we had, just not a few weeks ago, we had a lady in a senior community on the 3rd floor, hadn't smoked in years. And one of the staff persons had cigarettes in his pocket, and she asked him for one. He gave it to her. And then he gave her matches, and she was wearing oxygen, and she lit the whole dang place up on fire and blew herself up. She died a few days later from massive burns, and the facility's under huge trouble, every shipway and form you can think of, and it impacted all of their residents. And so their residents were punished for this. The families are being punished for this. The building had to go through this major overhaul, and now they're going to have to meet all these new FGI guidelines. I mean, it turned into be a freaking mess that didn't have to happen. So we've got to really get on top of things, and we've got to make sure our life safeties are working, our training's working, and then we think as a group. And I'm going to ask everybody that works with us, help us think this out, because I really don't have anything in my head that I think is any better than what we've had in the past and where we're going to go and how we're going to do this. If we don't come up with something, though, the department's going to dictate it. Okay. And one of the things Eileen's working on is she's trying to get some of this money that all of a sudden has come into aging and see if we can put a rainy day fund together to help facilities. So when the Superior fires happened, 2 facilities had to evacuate, not because they caught on fire, but because of the smoke. And they couldn't go to a hotel because of COVID. And they went to some sister facilities, but they couldn't get everybody. Or maybe some families took a few people home. We just we're not there. We really don't know what we're going to do. And then we just had either yesterday or the day before yesterday, a tornado in, I think it was Tennessee, went down in a community and picked up the whole darn nursing home. Picked the whole thing up and moved it. Now they were in a tornado closet, so to speak, but the nursing home was destructed, totally, just leveled. We're just not ready. We're not ready in any shape, way, or form of how we're going to cope. And then May, I'm going to start, I've been thinking about this for a long time, and I'm going to put more effort into it. I want to start figuring out how do we in our industry, it's not about how much we pay, though that's important to survive. We got to make it why you want to work in this industry and why all of you want to work in this industry. What attracts you? What keeps me engaged? What keeps the communication going? And why we just haven't ran and thrown our arms up in the air and ran for the hills. And we need to look at our staff that have stuck through or coming back and say, what can we do what would give you satisfaction? So I don't know if you pay attention, but Starbucks is going through the same thing we are. They're unionizing. Now, why would Starbucks employees be unionizing? It's an intermittent job. It's not a lifetime job unless you want to own one of the places. So you try to read between the lines. Why are you unionizing? What's missing? And that's what we've got to address as an industry. What's missing? What do you need? I hope that this is going to help, that if we can get better education, more consistent, and have programs that you don't have to think about, you just set them down and put them in and plug and play and hope, and then have a discussion about it that you won't forget to do, talk about it. I've had facilities across the state call me and ask me if I was going to do this again. And it kind of triggered me. And then I had a real special project, and it really helped me decide to go ahead with it. And so at any rate, that's what I'm going to work on. And then whatever you guys think, I want to know. I want to hear from you. All right, I had a couple of questions, so I added this slide yesterday. People are having trouble with CLIA, so here's the information how to get the darn thing if you don't have it. And then the next time I'm going to come together and I'll take some time. We've got a little bit of time. I can answer some questions. Please mark your calendars for the 21st of April, and you'll be able to register on our website. And maybe I can figure out with our IT person why our Zoom thing wasn't working today. And I really appreciate that you took time out today to come and hang for a while and think about some more things, and take the next month and work on some things and make sure you've got everything you need and start working on this. And this actually, everything I talked about today, we will put on your matrix for your QMP. Anything that you clean up, build, newly build, rebuild, whatever you're doing, I will help you put it on your matrix, because quality is second nature to me. I did it for a long time. So again, it's not, something I have to learn. It's okay. And I will share with you and help you with whatever you need to figure out. So let me see what's in the chat.